Welcome everyone for the webinar, ADC Inclusive Webinar 189. Today's topic is Basics in Implantology. This is a webinar series which will be conducted in multiple webinars. Today's webinar is first webinar, and today's presenter is ADC mentor, Dr. Ashvini Vadane. She is oral and maxillofacial surgeon and faculty at the Dental College. And she owns her own practice, Arunika Oral Surgery and Dental Clinic at Pune. She's a consultant oral and maxillofacial surgeon at various clinics in Navi Mumbai, Mumbai, Thane, and Pune. So let's welcome and thank you, ma'am, for joining for the series of webinar and helping all of us to learn from you. Welcome to today's webinar. Over to you, ma'am.
Yes, sir. Thank you. Thank you very much for inviting me for this lecture. So today's our topic is basics of dental implantology. So we will just deal with the basics things, and surgery and rest of the part we will see in the further lectures.
Yeah.
So
Okay.
yes, so the contents for today's webinars are, first of all, we will see what are dental implants. So that will be the introduction. Am I audible?
Yes, yes, very clearly.
Okay, yes. So that will be the introduction. Then we will go through some implant components. Then what are the classification of implants and indications and contraindications of dental implants. So these are very basic things that every dental surgeon should know. So
Yeah.
first of all, we will try to understand what is implant, what is dental implant. So as you can see on this left hand side part of this picture, it is of natural tooth.
Your
Which
slides are not visible, ma'am. Can you please share the screen? I have made the
mm,
changes in the setting. You had shared your screen
yes, I have shared it,
previously.
sir.
Okay. Now it is not visible.
I will share it once again.
Yeah, please.
Is it visible?
Yes. First slide is the basics of dental implantology.
Yes.
Yeah, fine. Thank you.
Now, is this slide visible?
Yes, the tooth and half
Yes.
implant. Yeah.
So, this picture is about, we will try to understand what is the dental implant. So, in this picture, the tooth is divided into right hand side and left hand side. So, on the very left hand side, please let me know if I am not audible or my screen is not visible.
Yeah, I will let you know in
Yes,
between.
sir.
I'm
Yes, sir.
here only. Okay.
Yes.
Thank you.
So, on left hand side, we can see, uh, I will start my pointer. Yes. So on left hand side, it is consist of natural tooth crown, which consists of enamel, dentin, and pulp, as we all know. Then this tooth, the lower part is the root of the tooth, and it is banded by the periodontal ligament, which holds our natural tooth into the bone. So in natural tooth structure, periodontal ligament plays an important role. Whereas the right hand side, it shows about the dental implant. In this, in bone, we have given a screw-like structure, that is the implant, and it adheres with the bone with the process known as the osseointegration that we will see in the further lecture. Then this is the implant abutment, which is the connector between the crown and implant. And but obvious in this crown is the artificial one, which is made by the dental lab. So this is the difference between the natural tooth and dental implant. So an artificial dental root that is surgically inserted into the jawbone and that can be used by the dentist as platform for prosthesis. It is known as the dental implant. It is the artificial dental root and we are inserting in this bone, jawbone surgically, and on that we will give our prosthesis. So this is the dental implant. Now quickly we will go through the implant components. As we can see in this picture, the first one is the crown. So it is same as the crowns we what we give for the after RCT treatment, whatever crowns we give, ceramic, then zirconia. So this is the same crown like that. This is the screw which connects the crown to the abutment and implant. Then abutment, it is a titanium or zirconia post that connects the crown to the implant. And the finally in bone, this is the implant or implant fixture. It is a titanium or zirconia anchor that mimics a tooth root, fusing to the jawbone and firmly holding the implant. So these are the implant components. Then regarding the parts of the dental implant, in this picture we can quickly go through that. So this last one, it is the implant body. Then this is the first stage cover screw. Then second stage permucosal extension, or we can say healing abutment. Usually we call it as a healing abutment. Then these are abutments. This is the hygiene screw. Then transfer coping, which can be divided as indirect and direct. Then implant body, abutment, coping analog, and prosthesis. So these are various parts of dental implant. Then apart from this, we should know about the screwdrivers. And this is the, just a second. And this is the torque driver. So till now we have seen what is the parts of the implant and what is the implant exactly. What is the difference between the natural tooth and the dental implant. So why this dental implant is needed or why we should recommend the patient to go for the dental implant. So first is the to avoid the tooth preparation and possible sequelae. As we all know, if we want to give the patient bridge, at that time we have to perform the tooth preparation of adjacent teeth. But in cases of dental implant placement, it is not needed. So the adjacent teeth will not be sacrificed. So that's why we can recommend or we can go for the dental implant. Then second is there is no need of connectors between the pontic and abutment teeth. Like usually if we are going for RPD, FPD, at that time we will need this. So there is no need of abutment teeth or pontic in this. As well as it avoids the mechanical risk of conventional bridges. And it is helpful for denture retention and support. That's why we should go for the dental implant. Then what is dental implant? So we can use it for the replacement of the single tooth as shown in the first picture, or it can replace the multiple teeth. So in this first picture, they have replaced the central incisor with the dental implant. This is the dental implant screw and implant crown. Whereas in second, they have replaced the 3 teeth with 2 implants. They have placed the 2 implants and they have given the 3-unit bridge. In this way, with the help of dental implants, we can replace the multiple teeth. As well as if we want to replace the all teeth in the arch, we can go for the 4-on implants. That is, they have placed the 4 implants and on that they have placed the entire denture. And this is the removable denture placed on the dental implants. So this is all about why dental implants are needed. In very first slide, we have already seen about this. The first picture, that is the labeled as A, it is of natural tooth, and second one is the dental implant. So as we can see, what is the major difference? If you observe very carefully, in first picture you can see there are the there is the periodontal ligament and blood vessels are there, which are going through the tooth. But in second picture, there is no any ligaments over here. The bone is fused to the dental implant by the process osseointegration. So this is the difference between the implant and natural tooth. So again, this is also beautiful picture about difference between natural tooth and implant. We have already seen this. So now we will see what is dental implant. Till now we have just seen the introduction part. Now we will go through the theoretical aspect of this. So dental implant, which is also known as endoosseous implant or fixture, it is the surgical component that interfaces with the bone of the jaw or skull to support a dental prosthesis such as crown, ridge, denture, facial prosthesis, or to act as an orthodontic anchor. So this is the definition. There is one more definition, textbook definition it is. It is a prosthetic device made of alloplastic materials implanted into the oral tissues or and periosteal layer and on within the bone to provide the retention and support for a fixed or removable dental prosthesis, a substance that is placed into or upon the jawbone to support a fixed or removable dental prosthesis. So this is the definition of dental implants. So we can place either fixed or removable prosthesis over the dental implant that we have seen in the last few slides. So the gist of today's topic was the introduction, and the second part was the components that we have seen, and the third is the classification of dental implants. So classification, it is very simple to classify dental implants. So first classification, it is based on the placement within the tissue. So according to that, endoosteal, subperiosteal, transosteal, and intramucosal. Endoosteal means within the bone, as shown in this picture, endoosteal, which is further divided into ramus frame, root form, blade form. So the first one, you can see the according to their shapes, ramus frame, root form, and blade form. Then the second picture is about the subperiosteal implants. In endosteal, we are placing it within the bone. In subperiosteal, we will put it below the periosteum. That's why it is known as subperiosteal. Then comes the transosteal. Transosteal, these are placed slightly deep as compared to the endosteal. As we can see in this picture, they are bisecting the bone, transosteal. And the last one is the intramucosal, which are placed in the mucosa. Then, based on the attachment mechanism of implants, as we have discussed in last slides, the dental implant, it attaches to the bone by the process of osseointegration or fibrointegration. So these are two types, osseointegration and fibrointegration. The mechanism of these types we will see in the further lectures of this series. But right now, just it is based on the attachment mechanism, we can divide or we can classify dental implants as osseointegration and fibrointegration. After that, the third criteria to divide the dental implants, it is based on the materials used. So first one is the metallic implants. So in this, the first one is the commercially pure titanium. Second is the titanium alloy. Then we can use cobalt, chromium or molybdenum. So these are the various materials which can be used for the dental as a metal for creating the dental implant. So we can classify based on the materials. The first point is the metallic implants. The second one is the non-metallic implants. In that, ceramics or carbon dental implants are available. Then fourth classification, it is based on the macroscopic body design of implant. So we can see in this picture, the first picture you can see the placed implant, it is the cylinder shaped. So that's why it is the cylinder shaped implant. This is the classification on the body design of the implant. Second one is the threaded implant, then plateau shaped implant. The fourth one is the perforated implant, then solid implant, and the last one is the hollow or vented implant. So these are the various types. After that, fifth criteria, it is the classification based on the surface of implants. So it can be smooth surfaced, machined, textured or coated. Then based upon the surface coating, in that titanium plasma sprayed, hydroxyapatite coating, grid blasting with titanium oxide. Then SLA. SLA is the sand blasted large grid acid etched. The fifth one is the acid etched and machined surface. After that, based on the implant material, it can be metallic, ceramic or polymer. These are the various types. So we have seen the classification of dental implants. So first one is based on the placement within the tissue. This is the most important one. Endosteal, subperiosteal, transosteal and intramucosal. Then second is the as per the attachment mechanism. So either osseointegrated implants or fibrointegrated implants. Then based upon the materials used, metallic implants, non-metallic implants. Then based on the macroscopic body design, cylinder, thread, plateau, perforated, solid, hollow or vented. Based on the surface, smooth surface, machined, textured and coated. And depending on the surface coating, these are various types. Based on the implant material, it is metallic, ceramic and polymer. So this was the classification of dental implants. So if any students are watching this webinar, this is the simple question which can be asked in your exam. Define and classify. At that time, you are supposed to write down all these things. So today's our entire webinar, whatever points are included in this, these are all exam questions. So if students are watching, this is really very beneficial for them. Then what are the indications of dental implants? For completely edentulous patients with advanced residual ridge resorption, where it is difficult to obtain the adequate retention. So if your patient is not having that much ridge, bone availability is not there, we can see that our complete denture or RPD will not get the proper retention. At that time, implant can be indicated. The second indication, for partially edentulous arches, where RPD, it may weaken the abutment teeth and also provides reduced masticatory efficiency. So as I have already told, why we are going for dental implants. So basic funda is that we don't want to sacrifice the adjacent teeth. So the second indication is about that only. If in partially edentulous arches, the removable partial denture, it can weaken the abutment teeth. And it can lead to the reduced masticatory efficiency. So in that case, dental implant is a good option. Then the third one is the for single tooth replacement. And the fourth is the patient's desire. If patient himself wants to go for dental implant, many times patient comes to the clinic saying ki I want dental implant. So in those cases, we can go for the dental implants. So these were the indications. Obviously, there are some contraindications also for dental implants. The first one is the oral health and hygiene. Oral health and hygiene, because if suppose your patient is unable to maintain his oral hygiene properly, there is no use of dental implants, because that will lead to the failure of the implant. Because dental placement of dental implant is the one of the surgery. So you are exposing the oral cavities, oral cavity with the external environment. Like your bone will be hampered, your soft tissue will be hampered. In these cases, oral health and hygiene is very much important, as well as patient should stop all his habits. Like if he's having habits of gutka chewing, mishri, smoking, everything should be properly maintained to give the successful results in case of dental implants. As well as proper toothbrushing, flossing. We all prescribe the electric toothbrushes for the dental implant patients too, so that they can maintain the proper hygiene. So that's why oral health, if you can see that patient won't be able to maintain the oral health and hygiene, so we should not go for the dental implants. So this is the first contraindication. Second is the systemic conditions, like if your patient is diabetic or if he is having any systemic blood disorders, then pregnant patients. In these cases, it's better to avoid the dental implants. Then third one is the structural and anatomic issues. Structural and anatomic issues means if suppose while placing the dental implant, you have to take into the consideration the quality of the bone. That we will see in the further lectures, quality of bone, D1, D2 and all. But quality of bone is very much important. Then how much bone height and width you are getting. So this comes under the anatomic aspect. As well as you have to take into consideration, in cases of maxillary arch, you will take into the consideration the sinus proximity. And in mandibular cases, inferior alveolar nerve proximity. So all these factors you have to take into the consideration while giving the dental implants. And the fourth one is the lifestyle factors. Like if the patient is not maintaining the oral hygiene properly, and if he is having some habits, in these cases, the dental implants we should not go for the dental implants, because it won't it won't give the successful results. So better go for the dentures. So the today's our topic was very short but very much helpful, because if we know the basics, then only we can go for the further complicated part of this implantology. So this is very basic. What is the definition? What are the classification? What are the implant components? And when should we give the implants and when we should not give the implants? So these were the basics points. In further lectures, we will see the surgical part, followed by how the how can we go for the success, how can we achieve the successful results with the dental implants. So I hope everyone has understood these basic things of today's webinar. Thank you.
Thank you, ma'am. It was so simplified and very step by step,
Yes,
very initial stage presentation.
yes,
I think it
yes,
should, yes, ma'am.
yes. So the motto of this today's lecture, when I was preparing, I just wanted that our viewers should know about the basics about the dental implants, so that once the basics are clear, then we can start with the advanced part.
Yeah, definitely. Even I had
Yes,
learned few things here that carbon implants are also there. I was
yes,
knowing only till ceramic. So a lot of
yes,
things are there which are very basic,
yes,
should be known to place the implants. I think
yes.
last webinar, Dr. Imran, now he's attending your this webinar. In the
Okay.
last webinar, he asked how to start with the basics. Dr. Imran, you're there. You had asked, right, in the last webinar that how to, you asked Dr. Mahendra Patel, sir, how to start with the basics. So we will go for the questions, ma'am. Uh, there is question from Dr. Pratik Parkarwar, sir. He is a representative for MSDC. He is asking time duration between implant placement and abutment should be how much? What is the time duration?
Yes. Regarding the implant time duration between the implant placement, sorry, abutment placement, the minimum time it should be around 2 to 2.5 months. But before that, we should go for the radiographic examination, and then we should take the decision of abutment placement only. But the minimum time is 2 to 2.5 months.
Okay, ma'am. Thank you, he is saying. And anyone else who is having any questions? This webinar will be continued further as a series of webinar, as Dr. Ashwini ma'am told. You will learn all the steps. There is one more question from Dr. Sakshi Ahuja. In placing implant supported prosthesis, what all points we should keep in mind?
Yes, uh, yes, but yes, we can talk about this, but this is included in our
Yeah,
next lecture,
next.
placement of
Yeah.
dental implants. For that, we are conducting the separate lecture.
Yeah. Dr. Sakshi, you
Yes,
attend
yes,
the further webinar, which will be on
yes, yes,
prosthesis, which is coming, I think, in the fourth or fifth step of the series
yes,
webinar.
yes.
There are
Regard,
10 webinars.
yes,
10
there is one
webinars
more
total.
question. Is there if patient
Yeah.
is diabetic? Yes, if patient is diabetic, then first of all we should take all his blood reports like BSL random, then PP postprandial, and if these are in normal limits, then it's better to go for the dental implant placement. If not in the normal limit, better we should refer him to some physician so that they will start his treatment. And whenever the basic sugar level will be in the within the normal range, then only we will go for the dental implants.
HB1AC can be done.
Yes, yes, yes.
One more question is there, ma'am, from Dr. Nikita Karbanda. Nowadays, immediate crowns are placed. So, any protocol for it? Immediate implants.
Yes, immediate implants we can go. Nowadays, yes, we tell the patient that after the extraction, immediately we will go for the dental implants. The basic protocol is that there should not be presence of any infection around that tooth, and there should be sufficient availability of the bone. And while performing that extraction, it should be atraumatic. There should be minimal bone loss. Then only we can go for the immediate implant placement.
Yes, ma'am. That is protocol for the immediate implants. She is also asking about the basal implants. Immediate crowns, she is saying. Immediate crown placement after the implant. That is basal implant, right?
Yes, but today's topic is just
Yeah.
about the introduction.
Yeah.
So basal implants are not included in
Dr.
this.
Nitika, this webinar is about conventional implantology. It is
Yes. Basic
cortical.
implants,
This is
that will
called
be
as
the
cortical
another
implant.
topic.
Yeah, this is cortical implant. You have to
Yeah,
attend the webinar on basal implantology.
basal
We will
implants.
conduct in future. Dr. Ashwini
Yes.
ma'am is not the mentor for basal implantology.
Yes,
It is
yes.
completely separate topic.
Yes.
Yeah. Samruddhi, Dr. Samruddhi wants to ask if acha, that is done. Diabetic question is done. Yeah.
Yes, that answered.
Uh, I think immediate loading of temporaries. Acha, you answered already. That. Yeah.
Yes.
Fine. Any more questions? Everyone is requested. You all are there in the WhatsApp group. So whatever your pictures are there of the cases, you document it and post in the WhatsApp group. So ma'am will help you because it is very step-by-step procedure.
Yes,
It's not
yes, we are
possible
going,
in. Hmm.
yes, as this is implantology series, as sir has told, we are going step by step. So today's is just basic introduction.
Yeah, yeah. This was fantastic webinar, ma'am. I absolutely thank you for this series of webinar. You are so much dedicated, and a really heartfelt thank you to you for conducting this webinar series. This is definitely going to help so many dentists. Today there are 18 participants. There will be more participants in future when surgical part is there. Because
Yes,
there
yes.
are so many inquiries about this. That's why I
Okay.
requested you for this webinar series.
Yes, sir. Thank you,
Really
sir.
thankful to you for this webinar series.
Yes.
As well as
Thank
you're
you, sir.
conducting oral surgery webinar series separately. So I
Yes, sir.
think there will be highest number of webinars on your name.
Yes, yes.
Okay. Thank you
Yes,
for
sir.
the thank you for good session. Dr. Pratik is thanking you, ma'am. So thank you once again from on behalf of ADC Inclusive. We wind up this session here, and we will announce the next webinar, that is webinar 2.0, conducted by same presenter, today's mentor, respected Dr. Ashvini Vadane ma'am, and we will announce in the group and with the link and date and everything. So next webinar is on 30th of November as of now.
Okay, sir.
Next Sunday, if any webinar is there, I will announce in the group. So for now, next webinar is on direct composites, direct anterior composites by Dr. Srujan Magar. That is on 30th November. And about 23rd November, I will announce in the group. So thank you, everyone. Have a nice Sunday. Take care. Thank you, ma'am.